Hello, welcome to my channel. My name is Nurse Pauline RN. I've had 16 years experience in the hospital as a registered nurse. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. Today the title of my video is Rest and Sleep. I will tell you everything you need to pass your exam in no particular order. Patients receiving sedatives, hypnotic agents is at risk for injury, falls. To validate sleep apnea, the doctor will order sleep study tests. Patients having difficulty sleeping, exercise in the mornings instead of in the evenings. Leave the bedroom only for sleeping. We have 4 stages of non-rapid eye movement. The first stage of NREM is drowsiness, decreased heart rate, light sleep. This is just when we're starting to sleep. The second stage, NREM, body processes slow down, temperature decrease. We are in light sleep. The third stage in NREM is one of the deepest stages of sleep. Growth hormones are released. Muscle relaxing, snoring takes place. Stage 4 NREM is delta sleep. It's a deep sleep. Some dreams occur, may be absent in the elderly. Now we come to the end. Now we come to REM sleep. In REM sleep, most dreams takes place. In REM provides cognitive restoration, rapid eye movement, increased metabolism, irregular vital signs. Stage 3 and stage 4 of NREM is deep sleep, most restorative stages of sleep, stage 3 and 4. Symptoms of sleep apnea: snoring loudly, frequent waking up during the night, decreased oxygenation, pauses of breathing. Assess obese patients, because while they're sleeping during the night, you'll be able to detect that they're snoring a lot and there is decreased pauses in their breathing. Always assess them and ask them if they do use a CPAP at home, because most of the time when they come in on admission, they forget to tell us that they use CPAP machines at home. So when you detect that, just ask them to bring their machines in from home. The doctor will give you an order for them to use it in the hospital. The respiratory therapist will assist us with the setting up of the CPAP machine. Patients on CPAP machine should be on a pulse ox machine so the nurse can monitor their oxygen while they are asleep. Patients at rest for obstructive sleep apnea, patients with nasal polyp, patients with enlarged tonsils. Antidepressants, antihistamines, beta blockers, narcotics can cause excessive daytime sleepiness. Adults vulnerable to decreased sleep, patients with chronic pains, patients with sleep apnea. Hypersomnia, patients obtain enough sleep during the nights, but they cannot stay awake during the day. Avoid heavy meal before sleep, at least 2 to 3 hours before sleep. Avoid alcohol, avoid caffeine, avoid chocolates 4 hours before sleep. Teach patients with poor sleep quality adequate hygiene. educate patients about their sleep medications, PRN, teach patients about fall prevention. Nocturnal enuresis is bedwetting in children up to 5 years old. Patients with obstructive sleep apnea, these patients will have low oxygen and increased CO2. These patients will be in acidosis. Narcolepsy, this is an overwhelming, irritable sleep occurs anywhere, maybe while driving. Teach patients to have plenty of carbohydrates added to their diet. Teach patients with narcolepsy, whenever they feel like sleeping, they should take short naps when they feel sleepy. Lunesta is approved by the FDA for sleep, PRN. In the hospitals, the doctors will order Ambien at bedtime, PRN for patients who need something to help them to sleep. Patients with Bruxism, this is a sleep disorder where patients clench or grind their teeth during sleep. Signs and symptoms of sleep deprivation: restlessness, irritability, withdrawals, speech deterioration, altered sleep pattern, elderly patients, periodic limb movements disorder, leg jerks in the elderly. Sleep talking occurs just when the patient is entering into REM. Somnambulism means sleepwalking. Barbiturates, amphetamines, antidepressants are medications that decrease REM sleep. Signs and symptoms of sleep deprivation: fatigue, headaches, increased sensitivity to pain medication, decreased neuromuscular coordination, irritability, difficulty concentrating. We should, as nurses, use sedatives with caution in the elderly because of decline physiology function. Hypothalamus controls circadian rhythm, which affects the body temperature, endocrine function, and sleep. Older adults promote safe environment. They can become temporarily confused, disoriented when they first awake. Teach sleep promotes health. Too little sleep leads to irritability, decreased concentration, poor judgment, moodiness, risk for accidents. Chronic sleep loss, increased risk for obesity, depression, high blood pressure, diabetes, heart attack, stroke, common sleep disorders. Promote rest with pain medications, decrease noise level, cluster activities all at the same time. Try not to be entering the patient's rooms during the night unnecessary. Cluster activities. Provide warm rooms. Elevate the temperature. If it's too cold, just turn up the heat a little. Provide warm drink, caffeine-free at bedtime. Have the patients going to bed at the same time every night. Remove electronic devices, television, computers, phones from bedside. Darken the room a little. You can use the night lights. Elevate the temperature of the room Sometimes the rooms are too cold. Give them additional blankets to promote sleep. Nurses' intervention for sleep: assess personal hygiene. Or for back rubs: do not exercise 2 hours before bedtime. Limit fluids 2 to 4 hours before sleep. Administer muscle relaxers if patients are anxious or stressed. Consider CPAP machines. Administer sedatives, and for example Ativan if it's ordered PRN. Sleep assessment for patients on admission: assess sleep patterns, assess changes in sleep patterns, assess sleep problems, assess factors that interferes with sleep, assess stress, mental illness, assess diet, assess exercising program, assess medications patients take at home for sleep on admission. We do all these assessments. Examples of isotonic exercises: examples are squats, stair climbing, push-ups, bicep circles, bicycling, walking, swimming, jogging. Please hit the like button, please. Please subscribe if you have not subscribed before. Please share my videos. Please comment below. Wish you success in all your exams. Have a blessed day. Thank you.